From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Well, summertime in Arkansas often means extreme heat. And while we like to get out and enjoy summertime activities, extreme heat can be dangerous. So Dr. Hamilton Newhart of Baptist Health Family Clinic in Lonoke joins us to discuss what to look out for and how to take care of ourselves. Dr. Newhart, this is a very timely segment because, wow, it's been so hot outside. Let's start with reminding everyone the symptoms of heat-related illness. Talk about some of those symptoms.
Yeah, sure. So some of the earliest symptoms that you might see with heat-related illness include things like muscle cramp, profuse sweating. You may have a little bit of dizziness, and those are kind of the early symptoms, and that's a sign that you might need to take a break from what you're doing. If you don't take a break and things progress, you may get some lightheadedness, you may even lose consciousness, have some nausea, vomiting, and those are signs that you may need to get an emergency evaluation or call 911.
Explain what heat stroke is.
So heat stroke includes all of the symptoms I mentioned before, but what happens in heat stroke is that your core body temperature reaches a certain level, and that level can cause brain damage. Fortunately, it is near 100% treatable if you're able to catch it within about 30 minutes and provide cooling and lower the body temperature. There is another condition called heat exhaustion, which includes all of those symptoms, but you may not see some of the change in your mental status, confusion, decreased alertness. And so it's important to catch that as well because that can progress into heat stroke if it's not caught.
If somebody has had heat stroke before, are they more prone to get it a second time?
The short answer is yes, you are more prone to get it a second time. There are certain populations that are at higher risk. Infants and children up to age 4 and people over the age of 65, as well as being overweight, having certain illnesses, or being on certain medications can cause you to be at a higher risk of dealing with the heat. And so it's important to follow up with a primary care doctor if you have one of these events to follow up and see if there's anything that may have contributed or anything that can be done to help prevent it in the future. But again, the good news is 100% preventable as long as you're aware and can take the necessary precautions.
You know, there's so many summer camps happening right now. There's baseball camps, I'm sure football camps are happening. Do you have any advice for those student athletes who are outside in this heat, or coaches and parents as well?
Sure. So for the coaches and parents, I think the key is to recognize the signs and symptoms and to take the precautions like we've talked about. Some of the precautions I would recommend is trying to avoid practicing at peak temperature times, so midday would be one you want to avoid. Try to practice earlier in the morning, later in the evening. Taking frequent breaks, especially in the shade, can help reduce the symptoms, and having water readily available. You know, you can trust your kids and your athletes to tell you when they're thirsty, and you should take that and make sure they have the time to drink the water and you're not exerting them too fast, too soon. Fortunately, in the state of Arkansas, there's laws in place at the high school level that protect the athletes and have restrictions on what the coaches can and can't do with practices, and says that they have to take a certain amount of breaks and can only go for so long. So that is one good thing about the state of Arkansas. But if any coaches out there or parents have any questions, feel free to reach out and I can help you develop or modify an emergency action plan to help deal with these things.
Well, you actually practice at the Baptist Health Family Clinic in Lonoke, as we mentioned before. So tell us more about this clinic and where exactly is it located?
So the clinic is within the city of Lonoke. It's on Front Street, and it's a newer clinic that's been established for about a year. We're taking new patients. We do urgent same-day visits. We have full lab, full x-ray, all the things that you would want with a new clinic. And we have a procedure room where we can do procedures such as joint injections, laceration repairs. We can do skin biopsies, skin removals, and anything you can think of, we can do it in our office. And if not, we'll get you to a specialist that can.
And you can see all ages?
Yes, we can see all ages from infants, babies, up to the elderly, and all ages in between. We see them all.
Perfect. And lastly, how important is it to just do preventative care for yourself?
Yeah, so preventative care is a key focus of our clinic and family medicine as a whole. Not only can it improve your health in the short and long term, it can reduce those big medical costs that can happen when you let things fester and don't get them caught early. And so it's important from that perspective. We can do pap smears, we can set you up for mammograms, colonoscopies, we do blood pressure monitoring, diabetes, cholesterol, we do everything, and we'll make sure you're taken care of. So come see us if you have any questions. We'll discuss diet and exercise if that's something you're interested in, weight loss. those are all things we can counsel you on. So.
Perfect. Yeah, we see your address and your phone number there on the screen now, so I'm guessing that would be the best way to contact y'all is to give you a call. Dr. Newhart, thank you so much for joining me today.